Naruvi Hospitals, promoted by the Sanko Foundation, is the brainchild of the founder-chairman Dr. G.V. Sampath. Belonging to Vellore, the medical hub of India, Dr. Sampath's vision to create a medical destination for the people of Vellore in particular and others from India at large and also overseas resulted in the establishment of a hospital here, a real crown jewel in the field of healthcare. Large numbers of people belonging to Vellore and the surrounding districts have been known to travel to Chennai and Bengaluru, both nearly 200 kilometers away from Vellore, seeking medical care due to the dearth of facilities and the hardships faced by the locals to access available services. As per the vision of the chairman, the best in healthcare, both in terms of medical and nursing professionals as well as sophistication, were infused into the institution, making sure that patient affordability was addressed at all times. Less than a month after Naruvi Hospitals opened its doors to the public, the second wave of COVID loomed large as life. We took on the challenge and quickly rose to the occasion, catering to the local population and some from outstation as well, adding close to 40 critical care beds and over 200 ward beds to the COVID care pool. Much as it was hard for a 1-month-old hospital to handle such large volumes of very sick patients, Naruvi Hospitals was able to contribute significantly in our country's efforts to save people from the disastrous end that COVID was driving people to. Naruvi Hospitals is positioned as a high-end tertiary care center. Our focus on ethics, transparency, patient satisfaction, and an academic outlook in everything we do ensures that doctors, nurses, and others in the care team are performing at their conscientious best to not only treat patients' ailments, but also to make them happy overall when they leave our hospital. We have tied up with the Henry Ford Health System, HFHS, based out of Michigan State in the United States of America. HFHS is one of the old and leading healthcare delivery systems in Midwestern America. The main aim of this tie-up is to have constant transfer of knowledge and to get access to the time-tested practices they have been following for decades, which ultimately translated to patient care. Naruvi Hospitals is a completely paperless and filmless hospital. The Naruvi philosophy of care is embodied by our motto, Fragrance of Care. The doctors in Naruvi are largely trained in the best of medical institutes in India and come with years of rich experience in their fields of expertise. With the philosophy and its pallbearers, the medical and nursing professionals, the high-end equipment, and the building infrastructure complete the holistic picture of Fragrance of Care. The hospital is 475 bedded with a 25% critical care bed count. Naruvi Hospitals boasts of an over 5 lakh square foot building spanning 14 levels. The building is completely air-conditioned, conforming to ASHRAE standards with zone-specific air conditioning to reduce cross-infection between different care areas. Our laundry is 100% barrier washed. We have a top-of-the-line sterilization department with machines with 95% water-saving machines, saving up to 300 liters of water every running hour. We have all the major medical and surgical specialties. There are 16 modular operation theaters with laminar airflow. All the equipment in the ICUs and OTs are pendant mount to avoid clutter on the floor. All the departments are equipped to the most modern standards with the best and latest equipment so as to be able to provide the best end-to-end treatment to our patients. State-of-the-art cardiac cath labs, the latest robotic hybrid OT, ECMO, interventional pulmonology, high-end orthopedics, general and bariatric surgery, epilepsy monitoring unit with robot-guided epilepsy surgery, neuro monitoring, navigation, the latest lithotripter, urology laser are just some of the arrows in our quiver. Our primary focus, though being the local Vellore people and Indians at large, we are working towards attracting overseas patients as well. We have started an office in North Sudan in Khartoum. We're in the process of tying up with the governments of Oman and Seychelles as well. In all, Naruvi Hospitals is more than a hospital. It is an experience.
Good morning, and thank you all for joining us today for our webinar on parenting in the digital era, presented by Naruvi Hospitals and the Hindu. This is a very timely topic today, especially because over the last 2 years, we've seen how much of an impact the pandemic has had on the lives of children. If schools, brought in a host of changes with online, learning leading the pack, even simple day-to-day activities that children could do, like stepping out to play, was, soon replaced with them being cooped up indoors with screens and with their electronic devices. Now, after 2 years, we need to see what kind of an impact this has had. Digital devices were always, gaining traction among parents and kids, but more so in the last 2 to 3 years when, most of them have been cooped up indoors. So to talk to us about this, we have three experts today. First, Dr. Sonia Mary Kurin, who is the head of pediatrics at Naruvi Hospitals, Vellore. She has over 20 years of experience in pediatrics and neonatology, and she has done her diploma in allergy, asthma, and CMC, Vellore. She completed her postgraduate training in Kasturba Medical College, Mangalore, and Kottayam Medical College, Kerala. She has worked abroad in the United Kingdom, where she completed her MRCPCH. The topic she will be talking to us today will be about screen time in children. Over to you, ma'am.
Thank you. Okay, can you hear me? Can you hear me?
Yes, ma'am, we can.
Yeah, okay. So good morning, everyone. Thank you for joining. Today, I'll be talking about screen time in children. And like this picture and the screen shows us how life was before the Corona time, and we started using more digital devices. Children used to play outside, play with friends, socialize, spend time with parents, learning new skills, reading, playing with children, and doing other extracurricular activities, and enjoying mealtime together as a family. But now with more digital devices, children are spending time by themselves, using different screens, and are not socializing as much as before. So these days, screen time seems to be all the time. So today we will discuss about what is screen time, the neurobiology behind the screen addiction, benefits of digital media, impact of screen time, and experts' opinion. So what is screen time, or what is digital screen exposure? It is exposure to any screen. It may be the TV, it may be the desktop, the iPad, the phone. And this is mainly used for entertainment, and it's unstructured time. So children may be given the phone and from a very young age, and the earlier they learn to use it, the more they want to use it. They may be in a room with a background TV on, and those children also will be distracted by the screen. Even with online schooling, children were using the screen, and then they continued using the screen for entertainment. So the screen is there always, most of the day. So how do children become addicted to the screen? Well, there are two mechanisms I'm going to discuss here. One is the reward system. So children, when they see images on the screen, fast moving, colorful, loud noises, the ventral tegmentum in the midbrain, it stimulates the nucleus accumbens in the basal ganglia to produce dopamine. So dopamine is the happy hormone. So children will get more of dopamine, they're more happy. So every time they see something in the screen, or they anticipate seeing the screen, they get very happy. And it's like an addiction. So like cocaine, like sugar, we want more of it. So children will be wanting more of the screen time. And if we leave it to them, they may watch it most of the day, their waking hours. But we have a prefrontal cortex in the front that is telling the brain, please stop, let's go and sleep, or let's do something else. But the other side wins, and most of the time, the child will go into that screen addiction. Another thing is, in children, the white matter is developing in the brain. The white matter is forming connections. So when we look at the child, talk to the child, the language center, the emotion center, the literacy center, all these centers are developing. But if we don't spend time, those white matter changes also will not happen, will not develop, and this will affect the child in the long term. But we know that digital media helps. How does it help early learning. So during COVID time, we knew that we needed the computers to teach the children. So schooling was through computers. We can learn lots of skills through the computer. We can learn art classes are there, dance classes are there, different skills, different hobbies we can learn through the digital media. And there are special programs which children have, which also helps them to improve their maths, improve their reading. There are many cognitive development we can do through online programs, and even social interaction to talk to parents, grandparents, relatives, near and far, friends. So social interaction also, the media helps, and also for functional development. But what happens is in early childhood, when a child, a small, few months old, few years old child, when they have been exposed to this screen, it's like a 2D communication. The child just watches the screen, but they don't understand what is happening. So we think that the child is learning the nursery rhyme or the whatever they're watching, but actually it's just they're just watching. It's like they don't learn anything. So the early childhood is a period of significant cognitive and behavioral development. That is when the child sees the parent's face, they know, oh, the parent is happy or the parent is sad. When they hear the parents talking, they learn how to talk. They can assess the behavior, they can assess the emotion of the parent. So the child is learning many things every time we interact with a child. Auditory, visual, all these stimulations are coming with normal interaction, but with TV or any screen, the visual overstimulation is there, and the child expects fast-paced activities in daily life, and lack of will cause them to have inattention. So they are, even after the screen, they are not happy, and they will not learn how to talk. They'll have delayed language development, learning problems, and also reading problems because they don't know how to do it. And so again, the child is left on to their own time. So inconsistent supervision also will delay social interactions in attention deficit, intelligence delay. All these will develop because they are not being, they've been just left to watch the screen. So if we discuss the consequences, it can be like a head to toe problem. So children who watch screen for a long time, they will have headaches. They will have neck pain because of the way they are watching the screen, the way their neck and head is on facing the screen. Because of the blue light or because of the screen being held nearby, they will have myopia. They will have vision problems, eye tiredness, sleep disturbances because of the blue light. Children as well, because they are not encouraged to talk, encouraged to communicate, they may not speak well. And even while eating, they don't eat well because they're watching the screen, they don't know how to chew. Full body is affected. They sit all the time. There is physical inactivity and they gain weight. When you take the phone away from them, they have conflict with the parents. So every part of their development is affected and they develop antisocial behavior. What they watch on the screen, they will start behaving, exaggerated behavior, and sleep will be disturbed, and they will also imitate what they're seeing. And later on, as they watch screen, they develop obesity, they gain weight, and their behavior also completely changes. They become more hyperactive, inattentive. As I said before, vision problems because of the eye strain. Even their motor skill development, they're not encouraged to use their hand, they're not encouraged to do activities, so their motor skills also will be reduced. Language development is affected. Eating disorders, children eat less because they don't know how to chew and eat. They're watching the screen, they don't know what they're eating, or they eat too much. And in the classroom also, they don't know how to engage with the teacher, engage with the students, how to behave. And later on, non-communicable diseases will be present. So we talked about language delay. Another big problem is childhood obesity. So as the child gains weight, their body mass index increases. If it is more than 85%, it is overweight, and more than 95 is obesity. So as the weight increases, they are at risk of heart problems, hypertension, the lipid levels, the fat levels in their body increases. They are at risk for type 2 diabetes, sleep apnea. They don't sleep properly. So they have attention deficit. They cannot concentrate in class. And because of the weight, they have social discrimination. And this obesity may persist on to adulthood. So all these problems are there. So what do the experts recommend? The AAP, American Academy, they say that less than 2 years, a child should not be exposed to any screen time. They should not watch the screen. They should not be shown a screen, except maybe for talking to grandparents, because that is an interactive session that they can watch what the expression is of the parents, grandparents. So that is for some, that is allowed, but otherwise they should not be shown any screen. Between 2 to 5 years, they're allowed around 1 hour per day, but that also should not be continuous. It should be 30 minutes, and then a gap should be there, another 30 minutes. And then you should not watch the screen while eating, and also before sleep. We should stop all screen time in the bedroom, and especially 1 hour before sleep for good night's sleep. And whenever parents are there, they should co-watch with the child. They should discuss with the child what they're watching, what do they think about it. So they're made to think, then they understand what is happening and they will learn better. And we should choose media wisely. We must see which is age appropriate programs and how it will benefit the child and help in their growth. And as a family, we must keep bedtime, mealtime, and family time screen free. And we ourselves, we should be a good role model and limit phone use. So we should emphasize on 3 things: sleep very important for growth, healthy nutrition, and exercise. The same thing which I had said, age-wise, the screen time. And at home, we also have to be role models. We have to also reduce the time we spend on screen, communicate more effectively, and we must be aware of all the digital advertisements. We must be aware that this is also influencing our children. We must go outside, play with them, encourage their creativity, encourage them to be a bit bored so that they can think of what should be done, and remove all devices from bedroom and set limits. And even in education, then schools also, the teachers and parents, and we should have how child should not be watching too much screen time. Behavioral changes, therapies can be provided by psychiatrists, and we must encourage physical activities, and facilities in the community should be present for promoting these activities. Thank you.
Thank you so much, ma'am, for sharing your insights with us. There'll be a question answer session at the end after all our 3 experts have spoken. So if any of the audience who's listening, if you have any questions, please drop them at the Q&A box and we'll look at them and ask the doctors at the end. I would like to introduce our next speaker, Dr. Shinika. Dr. Shinika completed her MBBS from Mohan Kumar Mangalam Medical College, Salem in 2013. She did her MD Psychiatry from the Institute of Psychiatry at Madurai Medical College in 2017. And then she pursued her fellowship in Child and Adolescent Psychiatry from the prestigious Christian Medical College in Vellore. Dr. Shinika is currently working as the team lead for the Department of Psychiatry and Child Development Unit at Naruvi Hospitals, Vellore. Her area of interests include early intervention for autism, schools and mental health, and also neuropsychiatry. Her topic today will be teens and their digital world. Dr. Shinika, over to you.
I'm sharing my screen.
Yes, go ahead.
Okay. Am I audible?
Yes, doctor, you are. Please
yeah,
go
my
ahead.
screen is visible, right?
Yes, your screen is visible.
Yeah. Okay. Thank you, Ms. Purvaja, for the nice introduction. So today I'll be talking on the topic of teens and their digital world. So also thanks to the viewers for joining us, and thanks to Hindu and Naruvi for this wonderful opportunity. So the pediatrician has spoken on the physical aspects of the impact of excessive screen time in children. So I'll be talking on the impact of excessive screen time in adolescents. So coming to the topic per se, from the moment I wake up, I will use it every day and very hard. So this is the plight of all of us today, including children and adolescents and adults as well. So what are the parents' concerns these days? What are the concerns with which parents approach us in the clinic, child and adolescent clinic these days? How do we cut down my teen's phone use? She's all time over the phone. My son is playing PUBG continuously until the phone's charge is dead. So we are worried if he is addicted to the phone or addicted to the game. My teen has an Insta account and he's posting very frequently in the account. So we are worried about this behavior. So these are the common concerns with which we see the parents these days and bringing their adolescents to our clinic. So with a brief introduction on what do the surveys say us about the screen time in adolescents. So surveys show that on an average, teens spend 3 hours online, which is not including the time for homework. And 90% of the teens between 13 to 17 years have used social media, and most have social media accounts. Of course, with the pandemic-related lockdowns, changing to virtual mode of online classes have actually doubled the screen time in children. And now, post-pandemic, post-lockdown, we are seeing the screen time is quite excessive even in children and adolescents. So we'll be touching on this topic of what is internet addiction. When do we call an child or an adolescent addicted to internet? When he or she needs to be brought to a clinic for evaluation. So parents ask us frequently, so is my child addicted? How do I diagnose addiction in him? When do I need to bring my child to the clinic? So this is the answer to them. So when do we diagnose addiction? When the time spent online is very excessive, there's excessive time spent online, not able to control the mobile use, not able to control one's mobile use, and not able to stay without phone, staying all time online, staying with the phone all time, not able to control one's mobile use. And because of this excessive use and the craving to stay online, to put some post in the social media, to put some post in the Insta, always the urge and the craving to stay online, to be with the phone online, not able to stay away from the phone. With this excessive use, and this excessive use is causing some decline in academics. There's a drop in academics. Parents would say, my kid was actually scoring 90%. Now, post-lockdown, we see the scores have dropped down to 70% because of this excessive time spending online. So once this excessive online use is causing the decline in academics, not only the decline in academics, their interpersonal relationship with people is affected. Their interpersonal relationship with what the people around the children, especially their peer group, they don't maintain their friendships as before. They don't talk with their friends. They don't communicate with their friends. They don't talk with their parents. They don't respond to them appropriately. They don't talk to them. They don't communicate with the parents. And their relationship with teachers is affected as well. So when this excessive use is causing some decline in academics, together with decline, there is also the dysfunction in maintaining relationships with teachers, with peer group, with parents, then this becomes an addiction. So the use is overwhelming, always wanting to stay online or always wanting to be online, not able to control use, and more so, they don't recognize that it is a problem. That is, on the top of it, it becomes difficult to bring them to the clinic for evaluation because they don't feel it's a problem. So when these symptom clusters of excessive use together with decline in academics, together with dysfunction in relationship with others, then it becomes an addictive disorder. A child or an adolescent definitely needs to be brought to the clinic for evaluation. So what is an impact? What is the impact of this addiction we talk about? Dr. Sonia was speaking more on the physical aspects of addiction with respect to the pediatric population. I would like to more touch on the topic of psychological impact. So what is the psychological impact of these addictions? Once the adolescent or teen is more and more into the mobile world, more and more into the social media world, they neglect others. Social isolation, neglect the family, neglect the peer group, neglect the teachers, school, and all. Try to be in a secluded environment, which is social isolation. Be more oppositional, like Dr. Sonia rightly mentioned. They'll become very cranky or adamant when you try to take the mobile away from them. More adamancy, tantrums, behavioral issues come up, and they become more oppositional. And of course, the decline in academics, as I mentioned earlier. And the most important aspect, which most of us forget, is the chaotic sleep rhythm. So because of excessive use, they stay up awake in the bed late nights. They sleep at 2 a.m., 3 a.m., be in the mobile, post something or chat with their friends. Because of sleeping late in the night, their sleep rhythm becomes chaotic. The sleep rhythm becomes disturbed. Because of this, they become more vulnerable. They become more vulnerable to develop either secondary depression or anxiety disorders. So this sleep is most important thing for any person, be it a child, be it an adolescent, be it an adult. So when the sleep rhythm becomes chaotic, the entire rhythms in the brain goes heavy, and they become more vulnerable to develop secondary depression or anxiety disorders. Not only that, not only these emotional disorders like they are also become more vulnerable to develop other comorbid addictions. Mobile addictions can lead on to gaming addictions. They will play games more, thereby they become addictive to games. So internet gaming disorder, they may be also get addicted to porn. So porn addictions comes here. They also may become addicted to other substance or drugs. So other addictive disorders also can be comorbid with the emotional disorders. So what is the social impact of that? They may bully others. They may become subject to bullying. Access to inappropriate content, either to sexting or cyberbullying or disclosure of personal information. All these is the social impact of excessive screen time in adolescents. So what do experts recommend? So when Dr. Sonia was talking more on the children, like expert recommendation for children, I'll be touching on the adolescent. What do experts recommend? Like, how do we handle? Because it's adolescent is a tough period even for a parent. It's a parenting is an art, so it is a tough phase even for parent to handle an adolescent. How do we handle? Because parents come to us saying, like, can my adolescent have an Insta account? Can she post in WhatsApp? So how do we handle this exactly? So to the parents, here are the recommendations from the guidelines, and this is what experts say. It's okay for your teen to be online. Total restriction of mobile use, total restriction of not to go to the internet won't help, because it's part of normal adolescent development. Being online or making online friendships, it's a part of normal adolescent development. That's the time when adolescent will start making friendships, be it online, offline, will start understanding themselves, start exploring themselves, and start exploring the world outside them. It's the time they kind of develop their personality also. So it is okay for them to be online. However, always make sure, keep the lines of communication open. Make sure they understand what is an appropriate behavior online, what is an inappropriate behavior, and keep always discuss with them. Be open to discussions, listen to them, which actually helps when they come up with even some doubts or something. It is always better we keep the lines of communication open. Set limits. This is where most of us actually miss out. We don't set limits. Like when we send our kid to play for cricket for, say, for half an hour, we don't set limits for mobile time. Set limits for mobile time as well. For, say, you can actually, after the finishing the homework, he or she can use mobile for half an hour. Like that, you need to set time even for mobile use, like how you manage the external world outside the mobile. And also make sure, keep your expectations clear, and make sure you explain the consequences as well and stick to them. So if your teen is continuing to use the mobile phone excessively for 2 to 3 days, then you can say them, like, a weekend outing is being cut for him or her. So you can, like this, you can make what is the consequences if this is not fulfilled. But however, we can offer them little flexibility if they're demonstrating responsibility. And make sure whatever you think about their social media, make a pact with them, whether you're going to friend, whether you're going to follow, whether you're going to post or not post, whether you're going to comment or not comment. Make a pact with them, make an agreement with them, so both of you are on the same page with respect to social media use. And most importantly, which will help us at the end of the day, is co-viewing, co-playing, and co-engaging. This holds good for children and adolescents as well, because this is the time when you view along with them. A parent co-viewing is nothing but parent and child sitting together and viewing a show, playing together a video game, engaging in an online activity. So sitting together with your child or adolescent will help us improve the bonding, improve the family interactions. It is also time for them to learn. By this way of co-engaging with them in a online activity, we can also make them understand your own experiences. By playing with them, we can also make them understand the gaming etiquettes. And by co-viewing with them, we can also improve the family interactions and bonding. It's also a good time for you to be with the child. It is, however, humanly not possible to stay with them all through the phone or through the end of the TV show. It's not possible, because we have our own codes or our own duties to be completed at the end of the day. So try as much as possible to stay with your child when they're online. Try as much as possible. It's not humanly possible to stay with them for the entire show, of course. we do agree on that. But at least for the first time when they view something, to see if the content is appropriate, you can sit with them and sit through the show. So co-viewing, co-playing, and co-engage is an important aspect when it comes to online activity. And as Dr. Sonia rightly mentioned, be a good role model to them. So kids actually, they learn more by imitating others, more by following what a parent do with their phone, how long they use, what apps they use, how do they play a game in a phone. All that comes by looking at their parents, not by their advisors. So be a good role model to them. Try to be cognizant of your own mobile use, of your own mobile time, of the games you play, all that we need to be more cognizant, because we are a good role model to them. Kids actually more learn by imitation or imitating their parents. And when most of us know, like we know the friends offline, but we forget about online friends. It's in the digital era, it's more importantly, we also need to know about who are the online friends, whom do teens talk to. All this knowing their online friends is important as well. And knowing what platforms they use, what softwares, what apps your teens use is also more important. It's equally important. It may be a little challenging for the parents these days to be updated or to go at the pace with the teen, but we can't help it in the digital era. We also need to know about their platforms or softwares, because to find if the content is appropriate, if it is safe for your teen. So we also need to know the softwares and apps they're using. And as a family, we need to have a family media plan on how we use, because our own use will have a greatest impact on the children and adolescents. So make sure as a family, you all agree on no screen while eating. So always make sure no one uses mobile phone or watch TV while eating. And when you're having a family time, when you're meeting or having family discussions, please make sure there's no screens at that time. And bedroom, especially when even in kids' bedroom or adults' bedroom, make sure you don't take your mobiles when you go to sleep. Keep it outside the bedroom, either keep it charged or keep it outside, but no mobile phones inside the bedroom. At least 1 hour before the bedtime, try to wind up the mobile use. And also for children, you can give them like until the homework is done, screen time is not allowed. So as a family, you need to have a family media plan on when you do not want to use the screen time. And for teens especially, this is more important to understand and making them ensure that privacy settings is on, like not to put up their address, their personal numbers, or the bank accounts, all that. The numbers should not be put up online. And also make sure, only by ensuring privacy settings on, that doesn't mean completely they are private or the information is not shared. What the content you're sharing also is important. Make sure the private contents or the personal information is not shared online. And when we talk about being a good citizen to your teen, we know we need to talk about how to be a good digital citizen, because being a good digital citizen is very important these days. Respecting themselves and others, respecting for privacy of themselves and others, respecting for copyrights, for intellectual property, all that is important in this new digital era. And what are the content that is put up, the language of communication, it should be kind, it should be true, and it should not have any misinformation, and it should be legal, and all this to be taught to a teen. So how to be a good digital citizenship. And also the digital footprints. What is a digital footprint? Whatever the information they leave in the media, it can be either shared, it can be it can even become viral. So the digital footprints, even if the person deletes, it stays online. So the trail of data that is left behind is very important. So make sure they leave only good digital footprints. And most importantly, also we need to warn them about the dangers of predators, about sexting, about bullying, cyberbullying, all that we need to warn. And we need to make sure that the teens discuss to us open when they encounter with bullying or sexting. They need to inform the parent and inform so that parent will take appropriate steps to protect the teen. And at the end of the day, kids are kids. They are bound to make mistakes. They will definitely make mistakes for sure, and embrace them. Make that as a teachable moment. Make them make that as a teachable moment, and offer them extra hugs, and say "I love you" more often. So to conclude, media and digital devices are an integral part of today's world. Benefits of these devices, if used moderately and appropriately, could be great. If the teens are spending excessive time online and they cannot control their use, if they cannot stay away from online mobile use, and if this excessive use is causing decline in scholastic performance, if this is causing disturbance in relationship with peers or parents, then definitely there is these are the red flag sites of addiction and internet addiction, and these teens should be brought for help to a mental health professional. So these are the tips for controlling screen for parents, because parents, only the parents' behavior influence the teens' behavior. So this is most important for all of us. So focus on co-engage and co-view as much as possible. Think about your own media use. Always prioritize face-to-face communication. Be snack aware and protect your own sleep. So these are the tips for controlling screens for parents. So thank you for this wonderful opportunity. We'll take up questions at the end of the session.
Thank you so much, Doctor. We've actually got quite a few questions during your presentation, which I'll ask, at the end of the session.
Sure.
Moving on to our next speaker. Welcome, Dr. Venkateswaran. Dr. Venkateswaran completed his undergraduation from the Pondicherry Institute of Medical Sciences and his PG from PSG IMSR Coimbatore. He also completed a fellowship at the CMC Vellore and has worked at the CMC Vellore as an assistant professor in child psychiatry. He's currently working as a visiting consultant in Kanchi Kamakoti Child Trust Hospital, Mehta Hospitals, and the Apollo Children Hospitals. Dr. Venkateswaran's areas of interest include autism, ADHD, adolescent-related problems, and gadget addiction. He has published articles in various peer-reviewed journals, authored chapters in books on practical pediatrics, given talks and chaired sessions in various national and international pediatric and psychiatry conferences. Today, Dr. Venkateswaran will be sharing parenting tips with all of us. Doctor, over to you.
Yes, thank you, Puroja. And am I visible and audible?
Yes, Doctor, you are.
Thank you. I'd like to thank the organizers and Puroja for this wonderful opportunity. So we'll straight away go into topic. So as my topic suggests, parenting tips. Okay, I'll give you specific situations. Okay, and how to manage kids when they are facing these situations, when they are anxious, when they are depressed, how to deal with the behavioral issues, how to improve cognitive functions like attention, organization, overall how to work on emotional intelligence and communication with adolescents. Okay, so these are the areas we'll see. So anxiety. Okay, so anxiety is basically worries. If your child or teen is excessively worried, okay? And before going into these situations, I'll tell you one thing. When it is severe, any of these conditions, when it is severe and limiting the child's day-to-day functioning or causing sleep disturbance, suicidal ideas, or causing gradual deterioration in academics, then you have to take medical opinion. What I am telling is, when it is there, when you are facing this situation, day-to-day situations, when it is mild, probably you try managing with these two. Sometimes the anxiety, all the anxiety are not abnormal. Okay, it is not that when the child is anxious, it is anxiety disorder. No. For example, 2 to 3 years, fear of thunders, lightning, it is quite normal. When they will start understanding concept about death around 4 to 5 years, when you have some death in your distant relative or somebody, the child will be very anxious. That is quite normal. And the school age, they will have some anxiety towards school, class, etc. As long as it is not limiting, then you need not worry about it. Okay. So what are the techniques? So there are two areas in anxiety. One is manifest anxiety. Manifest anxiety means that the child is going through palpitation, tremors, or very nervous, fidgety. Okay, so this is basically or keep sweating in some situation. This is called manifest anxiety. The second is, what is that negative thought related to leading to that anxiety? What is going in the child's mind? Okay, so these are the two situations. Manifest anxiety, you can practice relaxation techniques. See, for the time, like I'm not going into describing each and every steps in the exercise, but for young children, you can Google it. Okay, muscle relaxation technique for younger children. Okay, so they can simply practice this technique. So the manifest anxiety, that is palpitations or tremors, or the child is actually trembling. Okay, when you practice relaxation techniques, it will come down. For older children and adults, I would suggest abdominal breathing or deep breathing. Okay, so slowly ask them to breathe in, hold for a few seconds, and breathe out. In this, I like to introduce a slight modification. So there are two ways. One is focus on their breathing. Okay, or focusing on their breathing and slowly breathing and breathing out for 10 minutes, 15 minutes. Or if the child like drawing, okay, when they keep breathing, they can think about a picture, like the child drawing a picture. Okay, so this is a distraction technique. Okay, so think about a beautiful picture, the child is mental image of that picture, and slowly breathe in and breathe out. Whenever the child is visibly anxious, they can either practice this Jacobson relaxation technique for children, or simple breathing techniques with this modification. See, the breathing techniques, I want to add a point. It is commonly underplayed because everybody is telling me to breathe, breathe, breathe. So what is so funny about it? Okay, it actually improves our vagal tone. Okay, in our body, like there is a nervous system called sympathetic and parasympathetic. Okay, the sympathetic is like an accelerator, and this in anxiety that there will be excessive sympathetic activity. So when you practice this deep breathing technique, actually you are applying a brake, that is the parasympathetic nervous system, and it will give you a calming effect. Okay, so this is the technique which parents can encourage their children when they are visibly anxious. The second thing is, what is a thought related leading to this visible anxiety symptoms or manifest anxiety? Basically, in anxiety, the thoughts are worrying. Okay, what if I fail? What if I don't get that required approval? What if my peers don't call me for the party or anything? Okay, so when they have these worries, okay, then you can tell them to slowly sit and listen to their thoughts. Okay, so ask them to write their thoughts and help them to challenge their thoughts. Sometimes what happens, all these thoughts will be very in a very unchallenged manner, they accept it. Okay, it will be definitely a failure, definitely the teacher is going to scold me, the situation may not happen, but they will have this flow of thought when they are anxious. Okay, so make them sit and ask them to write down their thought. In anxiety, basically it is worries. Okay, once they write down, help them to practice these steps. How many times in the past has really happened? How many times you ended up getting scolding from your teacher? Okay, so maybe 90% of the time you would have done well. Okay, so basically uh, experience from the past. Okay, second is, what will you advise your friend when your friend goes through a similar situation? What is the advice you like to give? And is this way of thinking is really going to change the impact tomorrow in the school or the situation? Okay, so in these steps you try to uh, help them to challenge the thought so that they come to a rational thinking. Okay, let me try my best today so that I'll be able to cope up in the school tomorrow. Okay, so this is how they have to challenge negative thought, that is basically lots of worries and what if anticipatory failure. If they challenge the thought, they will become less anxious and able to perform better. Okay, so these are the two simple steps in handling anxiety. So next situation, depression. Okay, um, many kids, especially in the early adolescent and preteen stages, many of the almost majority of the adolescents go through this mood fluctuations and depressive symptoms. It is part of growing up. It is very common. No need to medicalize or stigmatize it. But if it is persistent, especially beyond 4 weeks, beyond 2 weeks, or if it is causing clinically significant dysfunction, that is, the child is very dull, all the time lethargic, no medical causes, or expressing suicidal ideas, then definitely you have to take clinical opinion. But more common day-to-day mood fluctuation and the child feels low often, then you can try practicing these simple steps. 3 A's. Accept. The major thing in depression is acceptance. Okay, what happens many times when the adolescents come and tell parents, like, I am going through this because of these things happened, I am going through this depressed feeling. Many times they will say, no, you have to change your mind, you cannot be depressed for all these things, you have to be strong. So what if so many problems will come later in their life, so how are you going to face all these things will happen? Okay, please don't do it. When they come and express some depressive symptoms to you, accept that and try to be there for it. Okay, it is very common. Even I have been through this when I was at your age. Don't worry. So we will be able to deal with it. Okay, so that acceptance itself will be able to make them comfortable, and 50 to 70% of the time we will be help them to overcome the depression. But many a time we don't accept. We will teach them how to cope up at that time. So don't do it. Acceptance. So second step is help them to activate. What is this activation? See, even this American Academy of Psychiatry, they have advocated physical activity to improve depressive symptoms. So, if they can practice some physical activity like a quick skipping or the punching a boxing bag or going for a jogging or a regular physical activity in a day-to-day physical activity, then it is protective against depression. Okay, so it improves mood by altering the neurochemicals in our brain. Okay, so and other step in activation is try to encourage them to stick with their routine as much as possible, because when they feel depressed, when they feel low, what naturally they will do is they will move away from their routine. Okay, so it will cause more and more depression. They lie still, it cause more depression, and depression causes dysfunctional routine, and this becomes a cycle. Okay, so break this cycle. So this discussion has to come before, if the teen is going through frequent depressive symptoms. So tell them, whenever you feel low, try to stick with your routine as much as possible. It will help you to cut short the duration of depression, and also it reduces the severity. Okay, so work with them in keeping them active whenever they have the depressed mood. Okay, and analyze same thing. The thought challenging. Okay, as I told for anxiety, here depression, the negative thought will be worthless, helpless. I'm not worth. So nobody is there for me. Those thoughts will come. So same steps. Sit, listen to that thought, write down that thought, help them to challenge it. Okay, whether is it really true? In the past, how many times it has happened like that? Second, how will you advise your friend? Third, is this way of thinking really helps you? So how should I reframe it? How should I change my thinking in a more positive manner? Okay, that is reframing. So if you could see, this is all principles taken from something called CBT. The core CBT is very difficult to teach the parents, but these are some steps which they can follow in their day-to-day life. So once they reframe their thought and they develop the habit of positive thinking, then slowly, whenever they get depressed mood, they themselves will go through this process and have a overall positive thinking in the end. This is like driving the car only. Initially, there will be confusion between brake, clutch, and accelerator. But as you keep driving, it will spontaneously come. Like this, all these thought challenges. Initially, it will be like a process, but you make them develop this habit as it pass by. So they will have the spontaneous positive thinking. They themselves will do in the subconscious level, and they will become more positive thinkers. Okay. The third is problem solving. Nowadays, like there are so many problems, like they are burdened with many issues. So you can teach them the simple techniques of problem solving, like state the problem and ask them to write different problems, and you take most important problem that immediately that should be solved. Don't get confused with all the problems you have. My friend is not talking with me. I have exams around the corner. My dad is not spending adequate time, for example. Okay, so and take most important one and try to think of different solutions. Evaluate pros and cons for each one and pick one and see it works. Okay, this is an exercise. Again, as I said, it is like driving the car. Initially, like you do it as an exercise, you teach them to have this habit of stating and writing and thinking of different solutions. But as they practice this, suddenly like they will be good at problem solving. Any problem they won't impulsively react. Okay, they will have the habit of thinking of different solutions and slowly picking the best one for them. Okay, so that their problem solving, it is a cognitive skill, will improve over time if they practice these techniques from the very young age. Okay. So these problem solving is a very important part of management of depression. Next is behavioral issues. So I'm not going to discuss what are the causes of behavioral issues for the lack of time, but how to handle behavioral issues. So I'll state something called what are the functions of the behavior. Okay, most commonly we see these three functions whenever the child has this behavioral problem: tantrums, throwing things, or being aggressive, or excessively crying. Okay, so these are the three situations. One is to get social attention. Social attention, and this is especially common in a small kid. Okay, you would have told them you should not throw the remote or something. The child will throw and see you. Okay, as if okay, you see me. Okay, I'm going to. I have thrown this. Okay, you give me attention. Okay, this is a way to get social attention. This is very common in a small kids. Defense. You tell them something to fold the clothes. You tell them something to read. Okay, the older children or adolescents, okay, I won't do. What may come? Okay, so this is defiance. And demands. I want this. I want that. Okay, you have to give me. Okay, this is demand. So these are the three common functions. So how to deal with it? The social attention. If it is a minor issues, especially a smaller kid, just ignore, move away. If you become panic and if you react to it, if you keep shouting at the kid, the child is going to do it more and more because child will not know the implications of it. So every time the child wants attention, he is going to throw and you are going to attempt. This is going to become a pattern, behavioral pattern. And when it becomes a pattern, then it is difficult to change. Okay. So try, you can give a feedback firmly once in a while. No, you should not throw. Like, okay, once in a while you can give a firm feedback. Still, the child is throwing. Try to ignore and appreciate when the child is not throwing it. For example, the second is defiance. Here, I want parents to be very flexible. What happens? The child will express this "I won't do" attitude in many situations. The parent will be struggling with the child for each and every situation. So, if you look overall, their routine will be intense parent-child conflict. For each and everything, they keep fighting with the child. Okay, so here, so you know what is the impact. Okay, the child is not aware of it. So you be flexible for 70-80% of the time. Small things. Don't take everything at a time and try to address it. So try to be flexible for small things and set limits only for the most important things. Okay, so this is, I leave it to parents to decide which is important and which is less important. Most often from starting of the day to end, the child will be struggling with the parents. The child will have lots of demands, and the parent will be struggling. It results in a very chaotic atmosphere. The demands again. Whenever there is a tantrums, here again, I want the parents to be a little flexible. Okay, if you want to yield before the behavior. Okay, you are busy. You have a relative in a house. You will not be able to set limits. Okay, don't say no for the sake of saying no. Okay, so you say no, the child behaves badly, then you give whatever the child wants, then this is not going to help. It results in understanding that, okay, let me behave like this, I'll get it. Okay, don't do that. Either if you are not in a position to set limit, yield to the demands or try to negotiate. But if you are telling no, whatever it may be, it is no. Okay, you can firmly tell them once or twice, no, whatever you do, I'm not going to give. So still the behavior continues, ignore or give a timeout. Okay. So when you practice this, initially it appears the behavior increases, but over the time, if you practice, try to be flexible and set limits. When you set limits, you maintain till end. So over the time, the behavior gets shaped because behavior is something that not develops today and cause problem tomorrow. Over the years, this pattern develops and results in severe behavioral problems. Okay, so follow these basics. Overall, these are the steps. When you handle a behavior problem, dissociate the child and the behavior. Don't label the child. You are a bad child. Okay, you are a bad boy. Okay, don't do that. You are a very good boy, but your behavior is not suiting you. Okay, so dissociate. Don't make them friends, make them enemies, the child and the behavior. The second thing is, as I said, if you have lots of behavioral issues, don't address everything at a time. For example, you are shifting from one room to another room. So you cannot carry all the things from this room to another room. Okay, you have to do one by one. Okay, or how much ever you could do. So divide and take most important behavior and work on it. So this differential reinforcement, I am not going to technical aspects of it. In simple terms, what it is, what we end up doing is we mostly will have negative communication. Whenever the child is not doing that, we spend lots of time in setting limits or shouting at them or punishing them or whatever it is. Okay, but whenever they are doing, we will ignore. So reverse it. Okay, so if you want your child to fold the bedsheet when they get up, okay, rather than shouting at them whenever they are not doing it, when you catch the good behavior, when they are doing it, you appreciate, be genuine in appreciation, and subtly ignore when they are not doing it. Okay, when you keep ignore means you can express your displeasure. Okay, I'm not happy that you are not done it, but don't react too much. Ignoring means it is a ignore. Okay, you can express your displeasure, but don't make it as a big deal. Okay, don't criticize. Subtly ignore and appreciate for the positive behavior. When you keep doing it over the time, you see the change. Like the child will end up doing more often rather than not doing it. So this is differential reinforcement. That is, catch the good behavior and try to underplay the negative behavior. If you see over months to years, the child will develop lots of good behavior. We will generally don't recommend punishment and nagging as well. Nagging means like the mother will want the child to study, all the time, like they'll be on their back. Okay, do this, whether you have done this, whether you have done that, whether you have done that. Okay, they will be like giving running commentary for each and everything. So this is nagging. Okay, in psychiatry terms, we call it as high expressed emotions. This is not good for the long-term mental health of the child. Okay, don't nag them, don't punish them. Okay, so try to practice these techniques whenever you have a problematic behavior. The sibling rivalry, this is also part of behavior management because most often parents come with they are not going well. Okay, so this is simple thing. The first thing, two things most of the parents will do. Okay, but if you are not doing, please do it. Treat them fairly. Okay, if you are buying something for a child, you have to better to get for both the children. Okay, don't give a preferential treatment for a child. Sometimes it is still happening in some families. The child may be studying well, the other child may not be a good performer like the other child. So you have the habit of rewarding for the performance to one child alone. Don't do it. Okay. So treat them fairly and don't compare. Each child is different. So this nowadays there is a very good awareness. Most of the parents are treating fairly and they are not comparing, but it is very important. And second thing is what is truth. Okay. Many a times, like the sibling rivalry, they will bring in the end. Okay, when it is very bad. Okay. Many times parents will say, "Don't bring your issues to me." Once in a while, the parents has to sit and discuss who's at fault and who should have done differently. Okay, this is very important. I don't expect you to sit with them daily and do this, but once in a while you cannot just like that ignore. Okay, sort out your issues within yourself. Don't come to me. We cannot have that attitude. Once in a while, try to find the truth and try to deal with it. Encourage interaction. Here, another mistake I see is interaction. When they will do it when they have problems. Okay, when the siblings are fighting, that time they will say the elder as an elder sibling, you have to take care of your brother. Okay, do this, do that. It will not work at that time. Encourage interaction. Otherwise, when they are cordial, like when they are good. Okay, when the elder one don't do anything, that time encourage interaction. Interaction range from playing together or range from taking care of basic needs of the younger one. All these things you can do when they don't have a problem. So don't encourage interaction during the problem. When they are fighting, don't do that. Okay, so encourage interaction. Otherwise, slowly they will start having positive interaction in the long run. And consequence management. Whatever may be, who may be at fault, there are something which the children should not do, like hitting, fighting, using abusive language, throwing things. So tell them responsible for consequences. Okay, once because whoever may be fault, you have hit them, so that is wrong. So this no zero rate behavior has to be very clearly told to the both the siblings. Okay, when you have these things, probably the sibling rivalry will come down to a significant level. Okay. So next topic is improving cognitive skills. The most often like parents ask like how to improve my child's attention, how to improve his planning organization. These are the examples of cognitive skills. We call it as executive functions of the brain. Okay. This is the power of the routine. Okay. So daily chart. I would encourage each parent to have a daily routine chart for all their children. Like starting from what time to get up, time to eat breakfast, like time to school, study time, everything. Once you have a daily routine chart, you should include all these aspects of routine. So for a overall development, holistic development, physical activity has to be the routine. Fine motor, like arts, crafts, or some kind of fine motor activity where they use their hands and focus. That do for half an hour. School activity naturally will be included in the routine. And they commonly miss this unstructured interaction. Okay, the child can play with other children without any structure, or the child can discuss some stories with parents without any structure. They can cook together, they can go for a walk together. Sometimes what happens, our day-to-day routine will become too structured and too need based. Okay, when I encourage physical activity, the parents will think only about whether I put in cricket, he will be a cricketer in the long run. Whether I put in tennis, he will be a good tennis player. No, like it is not all need based. Sometimes the child needs this unstructured or meaningless interaction, sometimes which gives them that psychological uh, peace and it will stimulate them. Okay, so it will help them to do well in these other areas. Okay. So other commonly ignored area is area like the parents will not engage children in their housework. Okay, so that is also very important. Okay, so they should learn all the self-care and housework from the very young age. Okay, as much as they could do depends on the child's developmental level. You should encourage them to do some simple housework. Okay, once you include all these things in a routine, you should reward them. So what happens here, when they don't do, they will start criticizing it. The thing I have told for differential reinforcement, they will start criticizing them when they don't follow the routine. This chart is to encourage them rather to criticize them. Okay, having a chart, and if you force them to do it, the chart will not work. Okay, when you start rewarding the children when they do this, follow this chart, and rewarding means you can have a star or something, you can monetize that. Okay, you for every 7 stars, 8 stars, you can take them out or some way to monetize a small gift or something. Once you start rewarding rather than criticizing means, for example, I'll tell you a situation. There is an open drainage and you close the drainage by yourself. I come and appreciate you. Good, you are a very good citizen. Then you will feel good. Okay. Imagine the same situation. There is an open drainage and I stand there. You come across that open drainage. I call you. Okay, madam, please close it. I'll give you 10,000. You get annoyed with me. Okay. So this is how the reward also works. The reward should come at the end of the behavior when they do, and you appreciate them for successfully doing. Need not to be 100%. Depends on the child's level. You can encourage 60, 70, 80, or even 90%. Okay, when they do it, you appreciate them. Slowly it will improve. Okay, so this chart is to reward them rather than taking the thing which the child has not done and criticizing on it. Okay, many a times this reward chart and other thing, ideal chart fails because they will end up fighting with this. Okay, you didn't do it today, and the child will demand reward without doing that work, and the parents will say you wouldn't do that, so they end up arguing this. So okay, so this is like we should end up rewarding more rather than criticizing, so it will definitely work. Okay, and attention, so this will improve planning and organization. The planning and organization is an executive function which should be developed from the very young age. Okay, this is very important for the brain maturity. Attention, so many times, like the parents say that my child is not focusing. Again, as I said, for depression and anxiety, when it is very severe, when they get complaints from school, when they cause significant dysfunction in academics, then you have to take a professional help. If it is mild distraction, then the things I would recommend is definitely the physical activity improve overall neurochemicals and improve their attention. And the schedule I told you, that focusing task, that will also improve them to help them to improve their attention. Third, in environment, the study environment should be less cluttered. If the table is full of books, if the table is full of some stickers, all the play item in the room, and other child being in the room, and lots of stickers and posters in the room, then naturally they are prone for poor focus in the studies. So keep the room simple, keep the table less cluttered, and give brief time intervals for study. For example, if the child is not really focusing, give some 20-25 minute sections rather than making them sit for 1 hour, 1.5 hours. Okay, give them 20 minutes to half an hour. Let them have a break, preferably a physical break. Have the short skipping session or a jumping session. Let them go around and come back. Then have another half an hour. Like that, if you give breaks in between session, keep the environment less distracted, encourage them with more physical activity and activity which can really help them to focus. Overall, these steps will improve child's attention in the long run. Okay, this will stimulate the brain. This will reduce the environmental distractions, and overall child's attention. In turn, academics will improve. The next is emotional intelligence. This is for older children and adolescents. Okay, nowadays it is only IQ is not important. EQ, emotional quotient, and adversity quotients are being emphasized more and more, because this is an era where we cannot function alone. We have to be a team player. Okay, if you cannot be a team player, then we will not be successful in any domain in life. Okay, so here overall introduce this concept of emotional intelligence from the very young age. These are the simple components in emotional intelligence. One is self-awareness, self-regulation, self-motivation, and interpersonal skills. What is self-awareness? We have to teach the adolescents or teen to be aware of their emotions. Whenever you are upset, whenever you are anxious, whenever you are angry, be aware. Okay, so they can give a self-feedback. Okay, I'm angry. Define it, and they will have a control. If they are not aware of it, definitely they are not going to regulate it. Okay, this awareness is very important before regulation. Many a times, all this anger management technique, do a simple deep breathing or punch a pillow. All these things will not work if they don't have an awareness. How to improve awareness? Simply by introducing the concept of awareness. Many a times we don't define it. When we don't define it, we won't understand. Okay, there is something called awareness. If you keep monitoring your emotions, whenever you have those emotions, be aware of it and tell yourself that you are angry. If they do it, definitely they will have better control over the emotion. So this is self-awareness. Self-regulation. Okay, if they are very anxious or angry, they can follow the same deep breathing techniques or just move away and sit in a calm place. If you practice deep breathing or distraction techniques, it is well and good. If you cannot practice when you are anxious or angry, just move away, be in a calm place. This itself will help. When you are depressed, activate. Okay, try to involve in a physical activity or try to stick with your routine. Okay, this is basically self-regulation. Any problem, no need to immediately sort out the problem. Okay, they can take time, regulate their emotion, then come for problem solving. What will happen is once they are emotional, the parents are also emotional. They try to solve the problem at that time. So it will end up in a bigger problem. It will end up in a bigger problem. Ultimately, the problem which caused these emotions will not be a big thing. Whatever they have done out of these emotions will become a bigger thing. Okay, so regulate. The self motivation, I was telling about nagging before. That they keep telling each and everything what the child should do this, do that, do that. If we introduce the concept of self motivation, teach the child. See, even I don't like to keep nagging you. I do not want to keep telling you everything. If you could develop this self motivation, introduce this concept. If you could function of your own, I like to be your friend rather than mother. Keep telling everything. Okay, so it is self motivation. You can also tell some stories, life of a successful people to improve the self motivation. But basically, the self motivation, if we introduce this concept, then you will not end up nagging them, and they will have very good confidence at the end of the day. Interpersonal skills, it is a very broad area. Briefly, you teach them theory of mind. Ask them to just think from others' perspective. Whenever you have fight with your friend, whenever you don't agree with someone, like just for a moment, take a break, think from others' perspective, and react. And XYZ method. What is this XYZ method? Don't keep bottling everything. Don't keep within yourself. Whenever you have some problem with a parent or a friend, gently, gently tell them this is situation, this behavior you don't like. Gently express. Okay, so whenever they do, though, they won't keep bottling it, and they will have a very good interpersonal relationship in the long run. That is theory of mind and proper communication then and there. Gentle proper communication then and there. When you introduce these concepts, their overall the emotional intelligence will improve for the adolescent. They'll be a much better person. The last, how to communicate with the adolescents. Okay, uh, we call it as calm communication, authoritative parenting, listening, and moral. Okay, this communication, as I was talking about nagging, whenever you want to tell something to your adolescent, don't keep telling, just write it in a notebook. At the end of 3, 4 days or a week, like you will find it most important thing to communicate. Just take that and make them sit and properly communicate. It is about the quality of the communication rather than quantity of the communication. If you keep nagging, if you keep telling everything every time, then your words will not be taken seriously and your tantrums will be meaningless. Okay, so communicate with the quality, right? You take important things, communicate whenever the adolescence is receptive. Okay, that is important in communication. Next is authoritative parenting. On one end, very authoritarian parenting. That is like a Hitler, punishing for each and everything, ridiculing them, giving punishment for each and everything. The another end is permissive parenting. Permissive parenting is okay, let it be. He will be upset. He will feel bad. So I give them everything. Both are dangerous in its own way. The middle ground is authoritative parenting, where 90% of the time will be like a friend. You will have lots of unstructured communication. You will discuss with them a lot. You spend time, but 10% of the time, for important things, you will set limits. Yeah, setting limits will not be emotional, screaming, shouting, hitting, or something. Setting limits very firm and very assertive. This is authoritative parenting style. Let's listen. More you listen, you will understand better about them. What we will do is we will end up judgmental. We will pass when they tell about something, we will start passing judgments. Okay, no. This is wrong. That is wrong. You have done like this. You have done like this. So they will next time they won't tell you. Okay, so they will keep it themselves. It will result in a bigger problem in the long run. So more you listen, you will understand them better. Be non-judgmental. Last is model. Madam was talking, Shinika was talking about role model. It's very important, and it is very difficult to be a good role model. Okay, here being a role model, you have to change your own personality. You have to be very dynamic, and you have to perform well. You are performing before your children. Okay, they will see you and learn rather than listen to you and learn. Okay, you tell something and you practice something, definitely then you are a poor role model. Then they will learn what you practice rather than what you tell. Okay, so here this model, everybody keep insisting, everybody keep telling, but it is the most difficult uh, to be a very good role model. So if you practice this communication technique, so then you will end up communicating better to your adolescents. Thank you.
Thank you, Doctor. Thank you so much. We've got a number of questions through the presentations. Thank you. Dr. Sonia has been answering almost 13 of them. There's one question here for Dr. Shinika that I thought I'll ask. This is from a parent who says that, you know, teens take it personally when we set the limits for digital usage, you know, basically set time. They think that the parent doesn't like them and hence they set limits. What do we do?
Sorry, can you come again with the question, please?
Sorry, Dr. Shinika, so a parent has said teens take it personally when we set time limits for digital usage. They think that parents don't like them and hence they set time limits. What do we do?
So it's like giving them a feedback. We need to give them a feedback, like when the parents take responsibility for the children, like they do set limits in the offline world, like they allow game time, they allow cricket time, they allow whether they can go outside or not. Like that, parents also hold responsible for setting limits online, making them, giving a feedback to them, like if at all this limit setting holds good for both, not only for the offline world but also for the online world. We need to give them feedback, make them understand, as well as listen to them. Sometimes, like Dr. Venkateshwaran rightly mentioned, we don't listen to them, we don't communicate with them. So making lines of communication open, giving them feedback, like the limit setting is both holding good for online and offline. It's not that because they don't like it. It's limit setting helps all of them. It is not only for the online to stay online. It is like help them have a routine, follow the routine, so that it doesn't have an academic impact, doesn't affect their interpersonal relationship. In that way, we can give a feedback to them and make them understand that limit setting is not only for the online, it's for the offline as well. It's similar to the offline, they make an online limit setting.
True. Thank you so much, Doctor. We're actually running out of time, so there's time just for one last question. Any of you can answer that. It's from a parent who said, who's asked, does excessive screen time usage or, you know, usage of digital devices result in mood swings? It's something that you've addressed in your presentations, but would you like to, you know, speak about that?
Yes. This excessive screen time, which when goes on till in the late in the nights, will definitely have an impact on the mood state of a child or an adolescent. For say they're waking up late in the nights, their sleep actually becomes chaotic. This chaotic sleep rhythm will actually dysregulate their mood, dysregulate their emotional state. They won't be able to regulate their own emotions. They'll either be depressed or anger when the phone is snatched away from them, or they may even throw a temper tantrum when they take the mobile phone away from them. So kind of this disruptive sleep rhythm and the chaotic sleep will actually dysregulate the mood, and also this excessive use over the time, it will become compulsive. So what initially they started using it as a pleasure, they used a game, started playing games, they started posting it. What initially started as a pleasure for them later will becomes a compulsive behavior. So when this compulsive behavior starts in, like it becomes a compulsion for them to stay online, for them to use, for them to always post. So when it becomes a compulsive behavior, definitely the mood state becomes dysregulated. Thereby, they become vulnerable for developing other comorbid depression or anxiety.
Thank you, Dr. Shinika. Thank you, Dr. Sonia, and thank you, Dr. Venkateshwaran, so much for joining us today. We've got a lot of questions, a lot of audience responses, and you know, a lot of them were addressed in the course of your presentations as well. Thank you all parents who joined us today as well. Thank you so much, doctors.
Yeah. Thank you so much. Thank you.
you.